President of the Republic of South Africa and the African Union COVID-19 champion, calling for the establishment of an AU Health Workforce Task Force. The AU, through the Africa CDC, is in the process of establishing this team to support the development of a fit-for-purpose health workforce. This high-level event is part of the ongoing efforts of the African Union with partners to advocate for investment in health workforce development in Africa. Specifically, I urge you to join us to: 1, advocate for further investment in the development of health workforce in Africa, both in quality and quantity. 2, strengthen monitoring, evaluation, and reporting on health workforce development with tools tailored to the African context. And 3, let us actively mobilize the necessary resources needed for strengthening health workforce development in Africa. To achieve this important goal, the AU Assembly in February 2022 granted Africa CDC autonomy to be able to fulfill its mandate in support of member states to achieve health sovereignty through health force development, but Africa CDC alone cannot meet this challenge. I therefore look forward to your recommendations and insights as you reflect on how we can move forward together. I thank you.
Thank you. Thank you very much, Chairperson of the Commission. Now it is my pleasure to invite Her Excellency, Madam Ellen Saleh, the former President of Liberia, and also from Africa Frontline Fast, to share with us her message for today. Your Excellency, you have the floor.
Thank you. Your Excellency, Mr. Musa Faki Mahatma, Chairperson of the African Union Commission, Excellencies, friends, ladies and gentlemen. I'm grateful for this opportunity to support the work of the African Union, its member states, and the AU COVID-19 Commission, as well as the AU COVID-19 champion toward advancing the health workforce on our continent. On the African continent and around the world, on health security, we are at an inflection point. The COVID-19 pandemic has affected every facet of our lives. The unnecessary toll of sickness and death from the pandemic is a blunt reminder that our personal health is inextricably linked to the health of all, especially for those living in rural and remote communities that are out of reach of the health system. In many of those places, community health workers, healthcare providers who live in the community they serve function as a foundation of the former health system. I learned this back in 2014 when the Ebola epidemic struck Liberia. With grateful support from the African Union, the US government, and our many other friendly nations, it took a shift in community-based responses, including enabling community health workers to help us curb and end the pandemic. This shift provided over the long term were able to protect Liberians from other infectious diseases, such as malaria, the leading cause of Liberia's deaths. In Liberia and around the world, we have seen the power of community health workers to deliver essential care in rural and remote communities. It is only through empowering those communities that we can assure life-saving services will reach the most vulnerable, ultimately preventing another pandemic from happening. Unfortunately, as has been pointed out by the excellencies who spoke, in Africa, up to 85% of community health workers, the majority of whom are women, are not paid for their work. It is time to correct this injustice. It is time to bring social justice into the mainstream of our work. Experience shows that professional community health workers who are properly paid, trained, equipped, and supervised are best prepared to provide essential health services in their communities, even amid great challenges. In Liberia, community health workers deliver half of the malaria treatment for children under 5, and there has been improved accuracy for diagnosing with rapid diagnosis tests from 70% to over 90% during the COVID period. For this reason, May of this year, I led the launch of the Africa Frontline First Initiative, a collaborative effort to train and deploy 200,000 new professional community health workers in Africa by the year 2030. In support of the African Union's new public health order and COVID-19 Commission, presided over by His Excellency President Ramaphosa, this collaboration pursues the African Union's broader target of deploying 2 million community health workers by the year 2030. A critical first step of the African Frontline Catalytic Fund, designed in partnership with the Global Fund. This catalytic fund seeks to mobilize at least $100 million to improve community health systems in Africa, and are providing essential medical care for up to 130 million. By investing in the training and paying cadres of professional community health workers across Africa, Africa Frontline First will provide quality jobs, but is primarily female workforce, extend across to essential primary care, and help prevent the next pandemic by expanding the critical surveillance network that is detected to detect emerging diseases sooner. I'm grateful for the anchor funding made by our partners, Johnson & Johnson Foundation, provided $15